The entire hind limb is draped off with a wide sterile field from tubericii, the inguinal area, and including the flank fold. I like to use a marking pen. We're going to come from the tubericii to approximately the mid-thigh level and include the flank fold in the excision, and an equivalent marking is made medially. The skin and the subcutaneous tissues are then incised, starting laterally and then medially. Next, we're going to abduct the limb and palpate for the femoral artery at approximately mid to proximal thigh level. The femoral artery and vein are bluntly dissected free from each other and circumferentially ligated. Here we're ligating the femoral artery first, and using that first suture, keeping those strands long and using them as a stay suture helps with manipulation of the vessel. We've doubly ligated the femoral artery and temporarily ligating the distal side that will go with the limb with a hemostat, and then the femoral artery is transected. Next, here is the femoral vein, and in this video we're just going to ligate it with a single ligature and temporarily ligate the distal side again. Now we're going to go through each extrinsic muscle, starting cranially and medially. This is the sartorius muscle, and typically we would be doing all of this a transection with electrocautery. So that was the gracilis muscle there, caudomedially. Next we're going to incise into the fascia lata and bluntly tunnel under the biceps, and next the biceps is transected. Here we can see the sciatic nerve revealed, and for these big nerves we will instill some bupivacaine or other local prior to transection. So the hamstring muscles are being transected next, semimembranosus, semitendinosus, and the adductor. The adductor inserts caudally onto the femur, so a little tunnel is made there first, and then the adductor is completely transected. Here the tensor fascia lata muscle is incised and retracted dorsally or proximally. Next we're going through the superficial gluteal muscle, and that reveals the middle gluteal. Middle gluteal is transected, which would then reveal the deep gluteal, and the deep gluteal is then also transected. The adductor is then further elevated off the proximal femur, and here we are now going through the external rotators of the hip, the gemelli, and the obturators. Cranially, the rectus femoris muscle crosses the joint and originates from the pelvis, so that has to go, and that usually reveals the femoral nerve, which is also then transected. Finally, here at this point we should be able to feel the lesser trochanter and also identify therefore the iliopsoas muscle traversing the hip joint cranially, and that is then transected. Now we should really be able to feel that hip joint medially, and I like to incise the joint capsule with a limb abducted ventrally, and upon the arthrotomy this should reveal the round ligament, which is sharply transected. You do have to be careful about some big vessels here medially, the medial circumflex femoral vessels. Some of the remaining tags of the muscles are then transected to completely remove the limb. Now we're going to evaluate for any tags that might need to be trimmed up. Be a good idea to look at all the different muscle bellies and know which one belongs where, how much redundant tissue there might be, and in this case we can see some redundancy of the gracilis, which we will subsequently trim up, also for the biceps too. Now we're going to close the deeper layer. Here I'm going from the gluteal muscles down to the adductor muscles. It's really important not to over tighten with these sutures. They're just opposing. They really should not crush the muscle. Just bring the muscle together. Now here we're coming more superficially, going from the tensor fascia lata to the sartorius muscle. Now going from the biceps femoris to the stump of the gracilis, and here I'm opposing those muscle bellies, which are quite flat, with a continuous pattern. Important to close the dead space, and at this point I'm applying a subcutaneous closure in a simple continuous pattern, and then finally applying our skin sutures.